This morning, the World Health Organization activating its highest alert level yet for monkeypox.
The global monkeypox outbreak represents a public health emergency of international concern.
At least 16,000 cases of monkeypox have been reported in 75 countries and territories this year. Here in the U.S., infections are climbing, now swelling to nearly 3,000 cases in 45 states. 2 children have been diagnosed with the virus, too. According to the CDC, they likely got sick through household transmission.
Both of those children are traced back to individuals who come from the men who have sex with men community, the gay men community. Those children are doing well.
The vast majority of monkeypox cases have been traced to gay men who have multiple sexual partners. Health experts say the virus can spread through direct contact with the infectious rash, face-to-face contact, or by touching contaminated items like clothing.
Should we be changing our behavior in any way to prevent getting monkeypox?
If you're not vaccinated and you're in that high-risk behavior group, I would say limiting exposure is going to be absolutely important.
But getting vaccinated hasn't always been easy, with the demand outstripping supply. In New York City Friday, 17,000 vaccine appointments filled up within a half hour.
It's been really difficult to find an appointment lately.
300,000 doses have been shipped to health departments across the country to address the outbreak, with another 5 million set to be delivered through the middle of next year. But in recent weeks, scenes of long lines stretching outside clinics show that another health crisis is tightening its grip.
And so far this year, there have been 5 monkeypox-related deaths in Africa, none here in the U.S. And health officials say that those who do get infected with the virus typically recover from their symptoms anywhere between 2 to 4 weeks, even without treatment. Willie?
Kathy Park in New York for us this morning. Kathy, thanks so much.
The fever didn't go away. I was taking ibuprofens, paracetamols, antihistamines, every single medication I could find, and nothing had. At this point, I started to call 111 to get help from emergency services. And every single time when I called them, I was told that this is not an emergency.
You know, the first few days, the first week since I realized I had it, it was mostly flu-like symptoms. So I had, an intense fever, full body chills, sweating through my sheets at night, sore throat, cough. Those lasted about 5 to 7 days, and as those let up, more and more lesions were appearing across my body.
I remember clearly that I cried on the phone saying that I think I'm gonna die because I can't eat, I can't drink, I can't even swallow my own spit. I am just very tired, just lying down, and nothing is happening.
With more than 70% of cases reported from the European region and 25% from the region of the Americas.
We know that from the countries that are reporting cases at the moment, roughly half of them have already secured access to this vaccine.
The global monkeypox outbreak represents a public health emergency of international concern.
I do think, unfortunately, there is real potential for stigma. There were quite a few, internet trolls saying really cruel, unkind things to me. And, I'm afraid that reflects in the real world too, right? Like if people who perhaps are homophobic or have prejudice or whatever see this, that could be used against the queer community.
It will be a struggle to contain the spread quickly. I think it will take many, many months for us to be able to get this outbreak under control. I do wish that the WHO and others in the international community had been more forceful sooner in raising the alarm, but it is better late than never. And
we're not without tools or a strategy, but it is just going to require more effort around the world to move quickly when these new outbreaks emerge.
And Wesley Wallace says he's been dealing with monkeypox for 3 weeks now, and it's not over yet. We want to warn you, this illness is graphic in nature, and we do not want to hide the severity of some of its symptoms, but you should know some of these images are hard to watch.
Wesley Wallace says just being awake,
it hurts to exist,
is excruciating.
As you can see, from the time it started, it's just progressed and gotten worse and worse.
It's right there on his face. What he first thought was just a pimple.
I was like, oh God, please not me, please not me.
Soon turned out to be monkeypox. 8 different lesions on his chin, even one inside his mouth.
Every sip, every bite, it's just like, oh, I can't, it hurts.
And it's spreading.
Now random little lesions are starting to appear on my body. So one on my hand, there's one here, like there on my wrist.
Wallace thinks he caught the virus at a bar July 4th weekend.
I'm going to say I probably was kissing somebody that had it and didn't know it, just based on where my initial lesions pop up.
But says access to the vaccine.
There's a huge high-risk population that is just hungry for the vaccine, and they don't have access to it.
Has been so scarce, his friends are leaving the state to get it.
I have friends that are actually buying airline tickets, flying to other cities just to go get the vaccine and then come home.
He says along with the pain and the symptoms can come isolation.
The thing is, you look at it and it's such an ugly virus. You know, you look at it, you just recoil and you're like, oh, I don't want to be anywhere near that. I knew the stigma that might come with it, but I also know that lots of people are facing that stigma.
He has support, but wants others to know they're not alone.
Just let them know that they're not some kind of pariah, that they're not dirty, and that it's going to be okay. It's not lethal. It's just very temporary, and it's scary for the moment.
Wallace thinks he's got another week or so before he's finally safe to be around people again, making his total time in quarantine about a month. If you would like more information on monkeypox and the efforts happening in our community, visit our website, khu.com/monkeypox. Guys, back to you.
A long journey in his recovery. Thank you, Janelle. Now, to clear up fact from fiction about the monkeypox virus, simply text the word pox to 713-526-1111 for links to the online resources.
Powerful words from the head of the World Health Organization amid rising cases of monkeypox.
The global monkeypox outbreak represents a public health emergency of international concern.
The declaration of a public health emergency, the first time the head of the UN Health Agency has taken such action. 1 month ago, there were more than 3,000 cases in 74 countries. Since then, the disease has spread, and now there are more than 16,000 cases in 75 countries and 5 deaths. Monkeypox is considered a mild illness. Symptoms, which start within 3 weeks of exposure, include fever, headache, fatigue, and muscle ache. A rash or lesions occur on the face and then spreads throughout the body. Doctors say it spreads through close contact, mostly through skin-to-skin touching, but can also spread through clothing or respiratory droplets in close range.
For the moment, this is an outbreak that's concentrated among men who have sex with men, especially those with multiple sexual partners. That means that this is an outbreak that can be stopped with the right strategies in the right groups.
However, there is no evidence monkeypox is sexually transmitted, and experts emphasize anyone can become infected. Last week, the U.S. Department of Health and Human Services says it ordered 2.5 million doses of the vaccine. Federal government expects to have 7 million available by mid-2023. This is the 7th time since 2007 the WHO has declared a public health emergency, according to the National Library of Medicine. The others include the H1N1 influenza of 2009, Ebola outbreak that began in 2013, and the ongoing coronavirus pandemic. Phil Lipoff, ABC News, New York.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.